starting this national briefing late. I'm sure the chairman will deepen this, the reasons for coming this late. We will be running this program in a very brisk manner so as to allow our colleagues from the media to, when we get to the question and answer session, please make it very brisk and make the questions pointed in a manner that they will be answered briskly as well. So we'll quickly roll into the program proper by inviting the chairman of the Presidential Task Force to please make his remarks, after which we take technical briefings, updates, and then we'll take your questions before the responses come in. Mr. Chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, once more, our sincere apologies for starting this briefing at this light. We had a whole day of very intense discussions on the stage at which we are now in our national response. So thank you, our colleagues here of the fourth realm, for your understanding. However, let me welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 10th August 2020. On Thursday, 6th August 2020, the Presidential Task Force intimated Nigerians with a new direction of our further easing the lockdown in our national response to COVID-19 pandemic. As we progress in this new phase of the eased lockdown, continual monitoring of global and national signs and data remains the basis for strengthening our efforts to contain the virus. Key sectors that the Presidential Task Force will be watching, in addition to general level of compliance, are the education and transportation sectors. Schools are gradually reopening with the commencement of preparations for critical examinations. Guidelines have already been issued by the Federal Ministry of Education to all stakeholders. For the transportation sector, the Presidential Task Force continues to follow the developments in the railway and air transportation, respectively. Nigerians and sector stakeholders are admonished to ensure compliance with the various non-pharmaceutical measures already in place. The Presidential Task Force and the Federal Ministry of Aviation are working rapidly towards reopening of the international airspace to allow for international flights. The Presidential Task Force will also be looking closely at the issue of risk communication and community engagement. Messaging and consultations shall be intensified to drive the level of awareness and compliance to the wider population using mediums and platforms that are most effective, generally and specifically. Today, the global numbers of confirmed cases surpass 20 million. And there's a record of over 750,000 deaths. These statistics remain serious warning signals, accompanied with pains and anguish to families and friends that have lost loved ones. Africa's confirmed cases have surpassed the 1 million mark, which is a landmark. The challenge, however, is that the true numbers could be higher, because we suspect strongly that for every reported case, up to 7 might have been missed. ladies and gentlemen, the numbers are surging. Community spread has taken root and expanded beyond the urban areas. Now we have infections right into the rural communities and localized areas. The watchword is vigilance and taking extra care. Nigeria today has 46,577 confirmed cases and 945 cumulative deaths. And that remains respectively the third and the fourth highest in these parameters on the continent of Africa. As we emphasized at the last briefing, Nigeria is yet to reach the peak of the pandemic. Therefore, the low test case confirmation numbers coming out daily should not be misinterpreted to mean that we have overcome this virus. We have over time ramped up testing, but more needs to be done to raise the quantum of tests per million. Our analysis has, however, shown that 5 states of the 36 states and the Federal Capital Territory, only 5, still account for 60% of cumulative cases nationwide. 2, 689 out of the 774 local governments as of today have reported a case. Therefore, 3, there are only 85 local governments in 20 states still have not reported any case or tested positive. And 4, 50% of all the cases are in 20 local governments. This statistics and information is important so that we can now understand the prevalence and the generality of the spread of the coronavirus in our communities. As of today, we have only 85 local governments out of the 774 that have not reported a case of COVID-19. Going by the surge and the growth in our figures, I do not rule out the possibility that very soon all the 774 local governments in Nigeria will report a case or two of COVID-19. The PTF is happy to note that many survivors are telling their stories and sharing them in the social media. The stories of those who doubted the existence of the virus and became unfortunately infected are now expressing appreciation for timely intervention of the case management team. That provides a compelling proof that the virus is real. I'm also happy to note that the electronic media has taken up our challenge of joining the risk communication as depicted over the weekend with the face-to-face interview conducted by the Arise News team, ably led by Amaka Ode. We thank the management of Arise News for the privilege of really promoting the experiences and the truth and the factual depiction of people who have been infected and who are still undergoing care in the National Hospital. We hope that other news medias will take up that challenge and go ahead so that we can drive this message home that COVID-19 is real, is still around with us, and people we know are going through the processes of recovery or receiving management care in our different facilities. It is also important I inform you that Nigeria continues to play its role in supporting the fight against COVID-19 on the West African sub-region. Last week, men and women of the Nigeria Air Force distributed PPEs and medical supplies donated by the West African Health Organization and other partners to our neighbors in the West African sub-region. However, to show true leadership against the pandemic, we as a people and country need to contain the virus by doing all we can to protect ourselves, our loved ones, and the country at large. I now have the singular honor and privilege to call on the Honorable Minister of Health, thereafter the DG or his representative of the Nigeria Center for Disease Control, and the National Coordinator to give us their updates and briefs. I thank you once more for your attention and have a very pleasant and good evening. Thank you.
Good afternoon, everybody. The Chair of the Presidential Task Force on COVID-19, honorable ministers here present, the National Coordinator, permanent secretaries, directors. As of 10th of August 2020, we have recorded 46,577 cases from 317,496 samples tested so far, while 33,186 persons have been treated and discharged. Sadly, 945 persons have been lost to COVID-19 infection, which has now been identified in 549 of our 774 local government areas. Half of all cases in Nigeria so far, over half, are concentrated in 20 local government areas, which could offer the attractive option of targeted attention to focus on case finding and isolation and treatment. The figures show that Nigeria is also sadly approaching the symbolic 1,000 number of fatalities, a grim reality that should be a wake-up call to all of us. Many more Nigerians today would have personally known a person who succumbed to COVID-19. And so I ask that we remind ourselves that COVID-19 is still with us and will be with us for a while. Until there is a vaccine, the only options we have to protect ourselves are still the non-pharmaceutical measures that are proven to be cheap and effective, such as the appropriate use of face masks, physical distancing, and avoiding crowds. If we do not adhere, there will be regrets. and the urgency is accentuated by the need to prepare for societal changes that will arise as the economy reopens with increased transportation, trade, human interaction, and even the option and possibility of reopened air travel internationally. We must make an effort to balance the benefits of a reactivated economy and not lose the gains made so far. Since Friday, the 7th of August 2020, we joined the rest of the world to commemorate what is known as the World Mask Week, the aim of which is to reinforce the importance of wearing masks to reduce the risk of spread of COVID-19 in the absence of a vaccine. Our focus is still to reduce fatality to less than 1%, not only with preventive measures, but also with a strategy that encourages citizens to report early for treatment and for hospitals to attend to all patients in distress. Most importantly, to be able to provide oxygen treatment. The main COVID-19 symptoms include breathlessness, which responds well to oxygen supplementation as a first measure. We are turning our preference, therefore, to gadgets that provide oxygen, like oxygen generators, to be in many facilities, including general hospitals and larger primary healthcare centers. Solar-powered aggregates, where available, will be prioritized. Federal health institutions with oxygen plants should activate them as a matter of priority and ensure they can deliver to their A&E departments. The other measure is the activation of ambulance service to move patients to treatment centers. This strategy worked well in Kano, and all states should prepare to set up the system. The Federal Ministry of Health will provide guidance and support and training. The National Council on Health, which is the highest policy-making body on matters relating to health in Nigeria, held a virtual emergency meeting on Thursday, the 6th of August 2020, during which the revised guidelines for the administration, disbursement, and monitoring of the Basic Healthcare Provision Fund, also called BHCPF Guidelines 2020, was approved. With this document, implementation of the Basic Healthcare Provision Fund, which was suspended in January to correct anomalies in the 2018 operation plan, has now resumed, and the process of disbursing fund has also started, right on time to support much needed state efforts in their COVID-19 response. The new BHCPF has much better country ownership structure and offers a much improved benefit package and a more robust fiduciary control for transparency and accountability. Development partners are invited to support the new revitalized plan in whatever manner they desire. We have made preparation to accommodate the varying programs and interests of our partners. The Ministry of Health is available to discuss and address the concerns and wishes of potential donors and users. The continuity of normal health services, capacity building of health workers, and their protection with PPEs are the most critical activities that we will wish to see secured. Resilient health systems ensure that basic healthcare provision fund services continue to reach PHC health facilities, which can be both public and private, and referral cases are sent to secondary healthcare facilities. It is critical in our present COVID-19 pandemic challenge to use the opportunity to strengthen our health systems. I also call on state, local government authorities, and healthcare workers to ensure the most rational and judicious use is made of all commodities provided. The National Council on Health also approved the establishment of the National Emergency Medical Service and Ambulance System, NEMSAS, an innovative system to pool the assets of public and private sector ambulances and hospitals, and also to raise funds to augment government seed money, to work with states to provide emergency medical care and patient transportation to all citizens whenever and wherever it is required, and irrespective of immediate or potential ability to pay. It will be possible to considerably reduce COVID-19 mortality and also reduce maternal and child mortality and post-crash mortality with a functional emergency medical service and ambulance system that can rely on the combined assets and efforts of private and public sector hospitals. It was my pleasure to receive the new leadership of the Nigeria Medical Association, headed by Professor Uja, on Friday, the 7th of August. And the visit offers the opportunity to re-engage the association for collaboration in addressing challenges in the health sector. We shall continue to value the input of our colleagues and also of all our frontline health workers as we move forward. I thank you all for your attention.
Before the representative of the DGNCDC takes the podium, let me just introduce her to you. She's Mrs. Ilori. She's standing in, she's a director in the NCDC, and she's standing in for the Director General. Mrs. Ilori.
Chairman, sir, the ministers, DJs, members of the press, ladies and gentlemen, like was said, I'm standing in for my DG, Dr. Chikwe Hekwazu. And today, we're going to focus on the wearing of masks. Like the Minister of Health said, we're joining the world to commemorate the World Mask Week. And as the number of COVID cases increases globally, this brings to the forefront the need to adhere to preventive measures. Therefore, wearing of masks is a key aspect of these preventive measures, and several studies have shown that its effectiveness in reducing the risk of infection. Wearing a mask in public, you not only protect yourself, but you also protect others around you. This is important because not many people will show symptoms. And some people you come across will not show symptoms. These are the people we call asymptomatic. They won't show symptoms, but they have the virus and they can transmit. But unfortunately, will show symptoms, and they are the vulnerable ones amongst us. And when they get sick, the possibility of being very fatal and dying at the end is there. So this is evident in our data. We are now closer to 1,000 fatality for COVID. This situation is not unique to Nigeria. It's a global issue, and it requires collective efforts. This is the 8th month since the world has been heavily impacted by this disease. And by doing our own bit, we can go through go through it much faster and making it, breaking the transmission. Doing our own bits means taking responsibilities and adhering to preventive measures on COVID, as well as emphasizing on the need for it within our family members and friends. When going out, wear a mask, especially when you are in a situation where physical distancing might not be possible, and that includes maybe in public transport or in the marketplaces. Face masks should never be shared. This is very important. You can use improvised masks. It's cost-effective, and we can wash it. I'm sure most of us are wearing that now. But the medical mask should not be reused. Please. It should be disposed of, and it should be disposed of properly in the waste bin. And let's wear our face masks properly, please. Under the chin is not effective. Also below the nose. We see some people wear it below the nose. That is not effective. You're not protecting yourself. You might be covering your mouth, but you're also taking in the air. So you need to cover your nose and mouth. That is when it is effective. When we are speaking, we should not put it under our chin because we are infecting it. If we want to speak, you wear it. Amplify your voice so that you can be heard. I think this will even help us with our singing because when we amplify our voices, that helps us for those that are in the choir. Yes. Well, mask is an additional layer of protection when in public. However, the purpose is defeated when personal hygiene is poor and preventive measures are not being adhered to. Other preventive measures such as avoiding large gatherings, frequently washing our hands, maintaining physical distancing also are important. Join our social media campaign. We have a social media campaign which says #MaskOnNaija. So let's be responsible. Let's take responsibility and fight COVID within what is within our own control. Thank you.
The chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. Last week, I spoke on the eased lockdown guidelines. Today, I'll be reiterating parts of the protocol again so that people can be reminded. Before I do that, I just wanted to emphasize the fact that the PTF continues to drive the fight against COVID-19 based on a very scientific approach that's data-driven. Every part of our protocol is carefully considered, is carefully discussed at the PTF, and we also look at the scientific basis before rolling it out. There's no doubt that COVID continues to be with us. For those who continue to deny the existence of COVID, I would say that close to 20 million people cannot be wrong. We have about 730 deaths worldwide. And indeed, it continues to be a threat to our way of life. We encourage persons above the age of 60 and those with an underlying medical illness to continue to keep away from the general public and to preferably stay at home. As stated at the last press briefing on Thursday, the eased lockdown phase 2 has been extended by 4 weeks from the 6th of August to the 5th of September. In terms of the various aspects of the protocols, the ones that I would like to re-emphasize are general movements. So the nationwide curfew remains from 10 p.m. to 4 a.m. We continue to have restrictions on mass gatherings, and the security agencies have been encouraged and asked to continue to take actions against repeated violations, and we will continue to do so in the interests of public health. Movement of people across state borders as well as goods will continue, but only outside the curfew hours. We have been working closely with the aviation and port health authorities over the last few days, and we are confident that we will start the process of opening our international airports as soon as possible, while domestic flights continue to be in operation. Transport services must maintain all non-pharmaceutical interventions and ensure appropriate PPEs for all healthcare workers. We are linking up with the Federal Road Safety Commission to ensure that the guidelines they have developed are enforced within the public sector side. For markets and restaurants, I would like to emphasize the need for mandatory non-pharmaceutical interventions, particularly the use of face masks. Restaurants are advised that they can only operate take-out services unless those restaurants are part of hotel accommodation. As mentioned earlier by the chairman, conditional opening for exit students in terms of schools has already commenced. Banks are now operating regular hours with limitation of their staff to 75% capacity. We urge banks to please accommodate those that are elderly, people who are living with disabilities, and customers that do not have access to internet services, and prioritize them. The policy of no mask, no entry, no mask, no service must be followed. For government offices, we have started operating full services Monday to Friday full-time, but only for civil servants grade level 12 and above. Hotels remain open, and we have removed restrictions on non-contact communal sports that are outdoors, but bars, gyms, cinemas, clubs, and event centers must remain closed. COVID is a silent enemy. It is an enemy that we cannot see with our naked eyes. Because of that, it's difficult to understand the extent of the risk we face. Behavioral change in itself requires discipline. It also requires visibility in terms of the risks that we are facing. But we can only get on top of the COVID pandemic by continuing to work together and have an enhanced self-awareness of our environment and the need to abide by non-pharmaceutical interventions. The PTF urges all Nigerians to take the guidelines seriously. These guidelines can be found on the PTF website and will be published on all social media platforms as well as newspapers. We all have a part to play in ensuring adherence. We certainly cannot win this fight against coronavirus alone. We have to do it collectively. We may have escaped the worst. We are pleased that the numbers are starting to stabilize, although this is a reflection also of the testing we're doing, but we know that the positivity rates are gradually coming down. Therefore, let us please persevere. This is not the time for complacency. Let us live, let us survive, and let us remain safe. Thank you.
Mr. Chairman, members of the PTF, distinguished ladies and gentlemen of the press, ladies and gentlemen from the Federal Ministry of Environment, an update on the conclusion of our decontamination and disinfection exercise of the examination centers. The Federal Ministry undertook the exercise along with environmental health officers, licensed environmental health officers, which was completed on Thursday in all the 36 states of the Federation and FCT. We have also established surveillance desks at all of these centers, and these desks are being manned by 40,000 environmental health officers volunteers that we recruited, who are there on hand to provide guidance in maintaining the protocol of COVID-19 containment. They are there to provide any assistance, and they also have PPE just in case somebody will start to present symptoms of the disease. They will be there to quickly isolate and evacuate. Also, there will be a daily decontamination of the examination halls, and we are still calling on parents to advise their children to be of good behavior and observe all the guidelines that will be stated there by the officials manning the centers. And these guidelines still remain: wearing of masks, washing of hands, use of sanitizers, observing the physical distances that have been provided by the officials there. I want parents to know that all these are being done to safeguard the health and lives of our children. The federal government, through the PTF, under the directives of Mr. President, is doing everything humanly possible to make sure that we contain the spread of this virus. Our next big exercise, which we will call exercise part 2, will come when schools open for conventional lessons nationwide. Jama'a assalamu alaikum. Za mu ɗan ƙara muku matashiya ne akan ayyukan da muka yi na tsaftacewa da feshe ɗakunan jarabawa da yanzu haka yara suke yin darasi domin ɗaukan jarabawan fita daga matakin firamare aji 6 zuwa ƙaramar sakandare, masu fita zuwa aji 3, har da kuma masu fita daga babban sakandare na aji 3. Mun riga mun gama feshe dukkan waɗannan gurare, mun tsaftace su, kuma mun samu shugabannin lafiya matsuguni a waɗannan gurare duka domin tabbatar da suna ƙara faɗakar da yara da malamai da suke gurin saboda ɗaukan wannan jarabawar, domin su ci gaba da bin ƙa'idojin da ya kamata. Wayannan malaman lafiyan kuwa akwai wajen 40,000 waɗanda duk mun raba su a wuraren da ake wannan jarabawa a dukkan jihohin ƙasar nan guda 36 da babban birnin ƙasa. Kuma a kulliyomin, in Allah yadda, za a rika feshewa ana tsaftace duk ɗakunan da ake ɗaukan jarabawa a kowace makaranta da ake ɗaukan wannan jarabawan. Har ila yau muna kira ga iyaye su ƙara jan hankalin 'ya'yansu, su ba su shawara su kasance masu da'a da bin umarni. Kuma har yanzu dai abubuwan da ya kamata a yi shine sa wannan takunkumi saboda kare lafiyanka da kuma na ɗan uwanka. Har yanzu maganan wanke hannu ko shafa wannan sinadari da ke kashe ƙwayoyin cuta, da kuma tabbata tazara wajen mu'amala wanda an riga an tsara a wannan guri. Kuma ina ƙara tabbatar ma da iyaye da 'yan Najeriya, gwamnatin ƙasa ta hanyar wannan kwamiti mai kula da daƙile cutar corona da ke aiki bisa ga umarnin shugaban ƙasa, da tabbatar da cewa duk inda ɗan Najeriya yake, mun yi yunƙurin duk abin da za mu yi mu tabbatar mun yi ayyuka, mun kuma fitar da ƙa'idoji yanda za a bi domin kare lafiya da kuma rayukan 'yan Najeriya. Abin da za mu yi nan gaba idan aka gama ɗaukan wannan jarabawa, wanda shine mataki na 2, idan aka buɗe makarantu duka a gaba ɗaya a ƙasa, in Allah yadda su ma ɗin za mu ɗauki nauyi ta ma'aikatan muhalli domin mu tabbatar da an feshe, an tsabtace waɗannan makarantu har ila yau don tabbatar da kare lafiyan yaranmu. Assalamu alaikum.
Thank you very much, Honorable Minister, Environment. We'll take the questions now, but please take heed of the appeal. Let's just go straight to the questions so that we can conclude this proceeding very fast.
Good evening, members of the PTF. My name is Friday Okeregbe. I'm a reporter with Channels TV. I would like to direct my first question to the National Coordinator. It has to do with the developments during the weekend. At the flag off of the rallies in Edo State and also the burial of Senator Buruji, we noticed that all the guidelines regarding the safety protocols were all flouted. None of them were kept with. We know that many times when we bring this to the PTF, there's always this little challenge as to how the PTF will show enforcement. And we've been told many times that it is the responsibility of the states to actually do that. But my question is the PTF actually handicapped? Since we know that many states are flouting these rules, is there nothing that the PTF can actually do to ensure that states will take these protocols that are read out every day seriously and enforce them? Is there nothing that PTF can actually do? The second question, I would like to direct it to the NCDC or the Minister of Health. Either of them can actually take it. It has to do with the guidelines for handling the corpse of victims to COVID-19. It seems unclear, so we need clarification. What is actually the guideline? Are corpses released to family members for burial? I do know that during the Ebola period, because of the nature of the disease, the state took responsibility for burying those who fell victim to that disease. And also the COVID-19, in some countries, states are responsible for burying this is just to manage the spread of it. What is our own policy here? Because we've seen many instances, family members are the ones burying the corpse and violations to the protocols. Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is to the Minister of Environment. So, with the increasing use of chemical for decontamination of places across the country, maybe some repeatedly, have we done an environmental impact assessment on the places that we go to decontaminate, on those locations, especially on the microbiota of these locations, to see how much impact on the short and long term of microbial ecosystem? Thank you. My next question is to the Minister of Health. Sir, as at last month, health workers in Nigeria constitute 5% of COVID-19 infection. Now, these health workers translate to about 1 in every 6 frontliners. How can we scale down on this in view of the implication of our response to COVID-19? Now, my last question is for Dr. Olori. I don't know why Nigeria is still making use of oral pharyngeal swab stick when report shows that the virus is found even in greater numbers in infected person. I ask this in view of the extra cost for swab stick, manpower, and let's not forget the discomfort associated with taking samples. Now, Nigerians would also like to know what is happening with the validation of test kits as currently going on by the federal government. Thank you very much.
Mr. Chairman, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia Orom from AIT. I would like to start with the Minister of Health. So some time ago, there was a COVID-19 hazard allowance that was approved for frontline workers like the health workers and also support staff. When I mean support staff, like the ambulance drivers and so on. But there was a circular that came from the Ministry of Health altering that agreement, thereby leaving some of the categories of these people out of that agreement that was earlier reached, which has caused like a protest from these people. So I would like to know what you are doing to avert the strike that these people have claimed that they want to embark on. And secondly, why is there an alteration of that agreement? Secondly, to Mr. Chairman, sir. So over the weekend, I saw this report that the World Bank will be assisting Nigeria with about $114 million to assist Nigeria fight COVID-19. I would like to know what how those funds will be channeled, especially in the health sector. And finally, still staying with you, Mr. Chairman. All right, some time ago, the Lagos State governor came up and said that they were closing down some of their isolation centers because the number of COVID-19 in that state was reducing. And we've also seen some states also have discharged all their COVID-19 patients. And yes, we see Nigerians are not adhering to these protocols, but ironically, our numbers are reducing. Can we say that we are defeating this virus? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Obaloyen of the Sun newspapers. The coordinator, this is for you, please. What is the sense in civil servants from grade level 11 and below not resuming yet when the same set of people are going to places of worship and markets? Still for you, and probably the Minister of Education as well, for states where schools have resumed for people preparing for exiting exams, what are the feedback you are getting? We'd like to know in terms of compliance level. Thank you.
Good evening, Chairman and members of the PTF. My name is Mitaire Ikbeng. I report for the NTA. My question is for the representative of the NCDC. Your daily statistics, COVID-19 statistics for the 4th of August indicated more than 11,000 cases discharged in 24 hours. I am curious, like many Nigerians, to ask, how did we get to discharge so much in 24 hours when we did not report a corresponding number of that magnitude of positive cases? Were they all admitted into isolation in one day? And if there were cases that were managed at home, who managed them at home? And are we likely to witness another massive discharge of cases like that in 24 hours soon? For the Minister of Health, as a follow-up on the issue of hazard allowance, doctors in university teaching hospitals and medical centers in MDAs say they have not been paid COVID-19 hazard allowance, and they are asking when will they be paid. Thank you.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. And 2 quick questions. First, to the Minister of Environment. We need confirmation from you. There are reports that some private schools in the states, particularly I think Kogi and I think one other state in the southwest, they said they haven't been decontaminated. And today you told us that you've covered all schools. So are you only focusing on the government schools or are private schools involved in your decontamination? So we need that from you. And the Chairman, National Coordinator. Well, the Chairman today ruled out some troubling statistics as it concerns our COVID-19 cases in the country with high burden local government areas. And the PTF time and time again had spoken about precision lockdown on some of these high burden areas. Is this likely to happen anytime soon so that way we can contain the spread of the virus? Thank you.
Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Salih Nazif. I work for Voice of Nigeria. My question goes to Health Minister and the Coordinator. The health minister, please. During this COVID-19, we have seen COVID patients with comorbidity receiving simultaneous treatment of both COVID and other health issues like hypertension, diabetes, cancer, and renal issues, which is very commendable. My question is, going forward, will your ministry advise government to subsidize the cost of treatment of these diseases through National Health Insurance Scheme, at least so that poor people can have access, because they too, they are suffering from these kind of problems. Secondly, looking at the submission by the SGF concerning the percentages of cases that we have at hand now, where he stated 5 states has about 60% of all the cases, and 50% of these cases are in 20 local government. My question to the coordinator, is there no need for change of strategy? Because it appears the issue of masks, wearing masks, and the communication with the people is no longer working very well. I mean the compliance. I was at a Suleja market, that is IBB International Market. I became a spectacle simply because I was putting masks. Seriously, I counted only about 3 or 4 people I saw with masks. So I think there's a problem here. What is the coordinator doing in communicating this message with the market leaders, market associations, traditional leaders, and faith-based organizations? Even in the mosques, Area 10 here, I observe Juma prayer. People are not complying, are not putting on the masks. So I think there's need for regular meeting with those people and change of strategy. Thank you very much.
Thank you. That brings us to the end of the question session. We'll be taking responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Minister of Environment, Honorable Minister of State Education, and the Chairman, PTF. We'll begin with the Minister of Health, please.
Well, thank you very much. Rachel, you sent your question to the wrong doctor, but I have it here. It's about health workers who are 5% of COVID infections and about 1 in every 6. How can you scale down scale this down in view of the implications or to our response? Is that correct? Yeah, okay, good. So as I said during my briefing, the healthcare workers are by far the most valuable part of the entire response, and we prioritize their safety and their security and also their comfort. So the provision of PPE is, we don't compromise with that at all. They are giving all PPE, and they are giving the training, and they also get refresher training. In fact, right now, there's some training going on, virtual, and in some cases on, direct person to person. So the reason we do all of that is to reduce the risk of infection of healthcare workers. Healthcare worker is infected, you have to check the family, they have to go away for some days, and they also because they are doing such frontline work, are very important in the entire system. So we do everything to reduce the risk of healthcare workers getting infected. We also advise healthcare workers not to try to manage this disease on their own privately, because some of them, as we got reports, have also gotten infected by trying to manage it privately, which is risky. If somebody is tested positive, instead of going to the hospital, goes to his house and invites a healthcare worker to come and look after him, and that person risks getting himself infected under that circumstance. So the other question has to do with insurance benefits. The National Health Insurance is working, we have been working with National Health Insurance on creating, as I also announced just now, a new package of health benefits, which is more robust than before. And this package of health benefits takes care of a lot of basic illnesses that had to be covered by out-of-pocket before. So by the time that package is unveiled, many of the concerns that you have spoken of now will be resolved, because you take care not only just of testing, but of supporting drugs and medication for those who are diagnosed with diabetes and hypertension, as was mentioned just now. It will be part of the package. And it's a very beautiful package that comes with the promise of this regime, of this government, to make things better for citizens. The unveiling will come a little bit later. Now, the hazard allowance, well, by the time we are trying to work out something for people who are involved in healthcare, in a country as big as ours, and with so many health workers and so many hospitals, a lot of calculation goes in. You have to get a list who are the healthcare workers, how many are working in this hospital, how many are working in that hospital, what are they doing. So the figures come in, some figures come in late, you're waiting to collate. Others you have already collated before they come in, some are miscategorized. And the result is that we get plenty of later requests that they have been miscategorized or that were not captured, all due to the fact that the system is in many ways trying to sort things out by itself. So I've had meetings with those who care to complain to me, and I spoke just the other day with the National Association of Resident Doctors. I've also had meetings with Johesu, and once they're able to clarify the position, the corrections are made. So we make corrections as soon as the situation is clarified. But the first response is not to go on strike or to start threatening strike. It's to try and sort out the errors, because collating these things is not easy. There is miscommunication. There are many times when a report you're waiting for takes far longer to come than you're expecting. And where those who are providing the reports themselves will admit that they made a mistake in categorizing or even counting the number of workers they have. So those are things which definitely come from some human error and will be corrected along the way. The intention is not to cheat anybody. The intention is to make sure that you are properly taken care of in the work you are doing. So, yes, with discharge of patients, patients are discharged following a particular protocol. At the beginning, patients had to test twice negative. You test them and they are negative for COVID-19. You wait 24 to 48 hours and test them again, and then they are negative before you discharge them. There are several treatment centers where it is being done, and each one does its own treatment according to the protocol that is laid down. So it can happen that you have a few patients discharged in total. It can also happen that by coincidence, a large number of patients are discharged on a day. It is not that they are all coordinating and talking with each other. The protocol has changed now since the knowledge came out that within 10 days, maximum, we make it maximum 14 days for those who have no symptoms, who do not have any, who have only a mild case, that the virus is in fact no longer active, and that even if you are to test them, they will be negative, and the few who will be positive actually do not have active viruses. The virus that tests positive is inactivated, and they are surely not infectious anymore after the 10 to 14-day cycle. So that is the criteria. Those are the criteria for discharging patients, and it can vary because of all the various treatment centers in the country. The numbers can vary from day to day or from week to week. I think that's all that came for the health sector. Yeah, just a word on the burial. I think that the NCDC representative will also say something about that. It's been found that the risk of infection is not comparable to that of Ebola. So the protocols are not identical. for between Ebola and COVID-19. So the protocols laid down by the World Health Organization are different and do not envisage that people should expect that they will all be treated the same way. At the beginning, there was a lot of scare about that, but the WHO has since released guidelines that have allayed many of the fears. Thank you.
Thank you for those questions, and I think my minister already answered some. It talked about the burial. Yes, there's a protocol for the burial, and like he said, it's quite different from that of Ebola. It's not as infectious as the Ebola, the corpse of Ebola. And so, but there are still, you still have to follow the guidelines. There are still protocols that you need to go follow. Once there is the corpse is well treated, we put in a body bag, and then the state team are actually responsible. They can hand over to the family, but the state team will work with the family and make sure that it is properly buried. That is how the protocol is. So there's a protocol, of course, and then we follow the guideline. So, of course, the family members will be part of that. For the oropharyngeal swab stick, it's actually still the best, and it's still what is being used globally. So, and that's what we are using. And the other question says, talked about the, okay, I think my minister already talked about the discharge, and then the test kit. Yes, actually it's the Medical Laboratory Council of Nigeria that is doing that with our National Reference Laboratory. They're still working on it. And once they get a result, we will definitely announce it here. So it's still an ongoing process. So I think I've answered the question. Thank you.
So I think the first question is very similar to the last one I have here, which has to do with compliance with guidelines and enforcement, particularly with reference to what happened in Edo State and the recent burial of a senator. So I must say we are quite dismayed with the level of compliance when it comes to some of these activities. And the issue is, we know that COVID does not act like a proper pandemic. What do I mean by a proper pandemic? If you have a proper pandemic like Ebola, as I've always said, you will have dead bodies on the streets, you will have people bleeding to death. So that shock factor is there, and you do not need to do anything further to convince people to protect themselves and to do the right thing. So ab initio, right from the beginning, we are faced with a pandemic that's an invisible enemy. We're facing with a pandemic where the majority of us will probably never come across somebody with COVID or somebody who may have died from COVID. So right from the beginning, we are faced with the task of convincing people to change their behavior, to change their risk perception with regards to a pandemic that is not as visible as other pandemics have been. We have been very lucky in this country. We haven't had the sort of deaths or mortalities that we have seen in other countries. But nevertheless, a lot of people have died. Close to 1,000 Nigerians have died that may still be with us today, if not for COVID. And I think the problem is not with the message. Maybe the problem is also with the messenger, with the way we communicate who is really delivering that message through. It's certainly more effective to have the traditional rulers, to have the religious leaders, to have your village heads, to provide that information that would enable you to protect yourself. We must definitely have to continue to engage Nigerians, enlighten them, and also encourage them to take those simple steps that are necessary to protect ourselves and our loved ones. So when it comes to wearing of masks, for instance, when you wear a mask, it's actually It's an act of kindness. It's an act of caring. What you're saying is you care about the people that you will meet. You don't want to infect them with COVID-19. So, and the same thing applies as well to when it comes to physical distancing. It's much easier to be proactive. It's much easier for civil authorities, for the leaders, for governments to make sure that those situations that pose a risk of mass gatherings are avoided. So when it comes to enforcement, for example, you cannot enforce behavior change for a prolonged period of time. The only way you can ensure compliance with behavioral change is by convincing people that it is the right thing to do, and you're also protecting your loved ones when you do so. So we'll continue to work with all parts of the community. We've just developed a new strategy in terms of risk communication, which we are also sharing with the state governors through the Nigeria Governors Forum. And the emphasis here is grassroots mobilization, reaching out to all parts of the community, including market women, including drivers within the various transport sectors, including faith-based organizations, right down to the grassroots, and convincing people that this is what you need to do if you want to remain safe. But there's no doubt we need a concerted effort, and there's no doubt as well that the duration of the pandemic is making people fatigued. But as I've always said, the virus doesn't tire. It's there, it's waiting for an opportunity to infect you. So if you get tired and you give up or you reveal your weakness, then that's the point at which the virus will take opportunity and infect you or your loved ones. But we'll continue to push, and we'll continue to work with all parts of society to make sure that the message is reached and people comply with our guidelines. And for those states that already have rules or acts such as the use of mobile courts, we'll continue to urge them. For enforcement officers as well, we'll continue to urge them to do their job in a humane way and to make sure that the public are educated and encouraged. So the other question has to do with the World Bank credit facility. Yes, so the World Bank board approved a facility of, I think, about $104 million US. It's a credit facility to the federal government, but a grant to the states. It will take a while for this money to come through, and it's going straight to the states to support COVID-19 programs in the states. The bulk of the money will go towards operational costs, so such as running a state emergency operations center, making sure states have a rapid response team, making sure they have facilities for sample collection, etc. Only a very small fraction of that will go towards procurement of PPEs because we don't believe the money will stretch that far. But it will take a while. It has to go through the necessary processes and approvals, both at the federal level as well as at the National Assembly level. Why did we stop civil servants below the grade level of 12 from resuming? So the interventions we put in and the easing of the lockdown is gradual. We don't want a situation where we release all civil servants to resume. And when we want to take a decision regarding the grade levels, we usually interface with the Office of the Head of Service. We find out what proportion of the civil servants, for instance, are below the level of grade level 14 and then grade level 12, etc., etc. Because what we're trying to avoid is congestion within the offices. We have to maintain that physical distancing. Now, when you say that, well, these same individuals are going to the markets, well, they're going to the markets to buy food. It's an essential part of their day-to-day living. But most markets are outdoors anyway, and we expect them to wear masks, etc. It's very different to you sitting in an office for 6 or 8 hours with a colleague. So that's why we continue to maintain the restrictions for all those below grade level 12 to remain at home. And there are also other aspects that we look at. So for instance, transportation. If you release a lot of civil servants to come into Abuja, a lot of them will use public transport. So you're going to have more congestion at the stations, more congestion when it comes to public, the taxis, etc., and it will be more difficult to enforce compliance with non-pharmaceutical interventions. So it goes beyond just people sitting down in their offices, etc. We usually consider things more broadly and the impact this might have on the overall response. But if things continue to improve, hopefully with the subsequent phase, we'll continue to relax these measures and people will be able to come to work. For those that are able to work at home, we're not saying you don't need to work. We did say that if you're able to work at home using your computers, internet, virtually, etc., not a problem. It's just that we don't want to see you in the offices for now until the pandemic continues to improve. Lockdown. So why haven't we locked down the high burden local governments? Well, first of all, we've just reviewed our data for the high burden local governments. We've expanded the number of local governments now to 20. We've added an additional 9. This has brought an additional 4 states, I think, into the fold. We're doing a lot of work with the first 11 local governments. I will be meeting with the state governors and the commissioners of health for the new local governments, the additional 9 that we have now included. And this work is across the board. It involves not only prioritizing surveillance, but also making sure there are sample collection centers in the local governments, making sure that enough PPE is available in the facilities, improving case management, and also establishing community isolation centers. Now, some of the community isolation centers will be in states that still have the capacity for additional beds. Some states have gone beyond that. Lagos, for instance, and the number of patients they have, it's impossible to bring everybody into isolation. But the main reason why we haven't locked down the 11 local governments is because of the technical side of things. So, as I said earlier, Lagos had 7 local governments. If you lock down 7 local governments in Lagos that are high burden, you might as well lock down the whole state. States like Bayelsa, for instance, the local government affected, is right in the middle of the state, and all the roads lead through it. So if you lock down that local government, you might as well lock down the whole state. So there were technical reasons why we couldn't do the lockdown. But provided we do all the other interventions and put in place all the other restrictions that we have, the impact should really be very similar to that of a lockdown. Thank you.
Okay, 2 questions. One is the environmental impact assessment on these chemicals. Yes, these chemicals are chemicals that are being used worldwide, and United Nations has approved these chemicals. World Health Organization has recommended the use of these chemicals, and they are being used everywhere. Will they kill other pathogens than coronavirus? Yes. Other viruses also will be terminated by these chemicals, and we want them to be terminated. So there's nothing wrong with that. Why total scrutiny now? Because the United Nations will have to check the efficacy of these chemicals. That's the rate of killing. We'll have to check their contact time, how much does it take to kill, and residual effect and all that. The total scrutiny is a lesson we learned from the 1960s. There was a chemical that was used as a pesticide. It's called DDT, dichloro-diphenyl trichloroethane. It's a chemical that was used as a pesticide. It was later realized that that chemical also turns out to be a carcinogen. That is a cancer-causing substance. Whether in the water that the chemical got into, the plant crops, even wild plants that people consume, it was realized that has caused so much havoc on the people and the environment. And immediately that chemical was banned. And to date, DDT is never used in anything. So I think it's from this lesson that we understand that we have to take time to analyze and scrutinize chemicals that will be used as disinfectant or pesticide or anything like that, that will come in contact with humans and the natural environment. The other question as to whether we have decontaminated private schools, no, we haven't. We told them to decontaminate and disinfect their schools. The guideline is that they must use licensed environmental health officers, and they are all across the country. Until they do that, we will not certify your school as being decontaminated and disinfected. Thank you.
Good evening, everybody. Yes, we have taken a tour around most of the institutions around the country. All the reports from almost all the states are positive. I have inspected a few myself, and I'm quite happy with what we met on ground. We've seen how our students have been carried out, the social distancing in the dormitories and the classrooms. The awareness is very, very high. They returned with all their face masks, their hand sanitizers. Some schools are doing a refill pack for their students. Some only part we are not still very comfortable with is students themselves. Once they get out of class, they begin to behave like young people as well. So that they get together, hugging each other and playing. There's no way around that one because we can't sleep with them, drink with them, or flog them for being socializing with one another. It's almost very difficult. So in all the schools, all those things that need to be done physically. I inspected many of the proposed sick bays, isolation positions, everything that we asked them to do. The directors of FECAS, or what we call our Quality Assurance Unit of the Federal Ministry in all the states, have reported positively. I met repeatedly with commissioners of education, and on Monday last week, all of us reviewed what they had done. On Wednesday, I met with all the governors, and I also commended what they had done. Many of them had already gone way ahead of us before we did this. So there's a unanimity around the country to try to give our students and our children the best, put their first foot forward. So we just want to pray for them and ask them to revise strongly, look at the timetable that WAEC has set, the one that NAPTEB has set, and those from NACO. We've also made the arrangements to continue registration for NAPTEB and NACO so that as WAEC exams begin to conclude and ahead of the onset of those exams, they would have had an opportunity to hedge for courses that they may not have done well. They may actually begin to register since the national business and technical examinations are coming on board immediately after. They can use that to augment areas that they may not have as well. But we're confident that our students actually, even while it is that I only saw many at the federal government colleges who may be actually more ahead of others, but we are confident that in so many private secondary schools around Nigeria, I saw a few from Imo State that are way ahead of the syllabus, who have actually done quite very, very well. Some people actually used the period the way we prescribed. They were online, they used a lot of the resources that had been made available on the Ministry of Education's website, and they had interfaced using all the communication methodologies that we had introduced. So we are quite confident. But if there are any the hard infrastructure. So while you may think that it's not an industry, it actually is the main industry in Nigeria, the industry that produces you and I. And I urge that we reflect on those. The same thing, we want to commend parents who have helped us so far. Everything we've done, couldn't have done without parents. Fortunately or unfortunately, many of them have had to stay home to be able to guide and deal with this situation alongside. So many of them are continuing to do that for our students who are not in exit classes. So I've also come to say thank you to them and to commend the work they are doing on our behalf and to urge them to do more. Thank you very much.
Thank you, Honorable Minister of State Education. I now invite the chairman of the PTF to the podium.
Members of the Presidential Task Force, I think, distinguished ladies and gentlemen, all the questions have been taken. The one about the World Bank, Dr. Sani has quite effectively answered that. He has been working on that. He set the templates of some of the things that should happen. Then Amaka did ask about the heavy burden local governments and the precision lockdown. And that has also been taken. But let me just close by saying that last week, I think it was Thursday, when during the briefing, I gave these statistics that indicated as of the end of June, we had reported 500. We had confirmed cases of COVID-19 in 536 local governments out of the 774 local governments. And you can see today I'm reporting that there are 689 out of the 774 local governments. And there are barely just 85 local governments left. You can see the increase from when I reported last Thursday, though the statistics was up to the end of the month of June, and what you have now. And like I said in my remarks this evening, that the likelihood of completely covering the entire nation with COVID-19 in terms of reports from the remaining 85 local governments, it would not take a long period of time if we go by the increase in the figures, probably given the next 1 month. So we are at a very dangerous state of community transmission. Whether the numbers are high in those local governments as per the tests that have been conducted, reports confirming the positive numbers, whether it's high, it means that at this stage now, we must recalibrate even the risk communication, which you rightly observe. One of the media persons that asked the question here spoke about the fact that the message is not reflective of what is out there in terms of compliance. And that's where the danger lies. That for now there is no cure, and vaccine is way ahead before we get there. The only weapon available to us are the non-pharmaceutical interventions or measures that have been put in place. And at the rate at which the infection is spreading into the rural areas, if we do not extract by whatever means, either by way of enforcement, either by way of persuasion, either by way of having new messengers that will carry these messages. The risk communication aspect of this response to the hinterlands of our country. The consequences will be there, and they will be tragic by the time the levels of community infections blanket the entire nation. You know how rural some of our constituencies are, and how inaccessible, especially at the peak of the rainy season as it is now. And with the pervasive nature of the flood that have been predicted by NIMET and all other agencies responsible for predictions of the heavy torrential rainfall we are going to have this year, the whole place will be flooded, and you have people infected with COVID-19 in rural communities that cannot access the necessary care. And that is why the message of complying with the non-pharmaceutical measures that have been introduced cannot be wished away, because that's the only remedy we have as a people now. That's the only remedy the entire world has at its disposal. With no cure in the foreseeable future, probably vaccines will show up before the end of the year. But the reasonable time you should expect a vaccine is probably 12 to 18 months for human use. I'm saying this so that you can also take the responsibility more seriously in driving home the point that the only remedy, the only weapons we have at our disposal now as a people and as a nation is to get the buy-in of our people, to ensure that, one, they wear their mask, and it's not a joke. By now, virtually everybody has come in contact with somebody who has either been infected and he has survived, or he has had or known of a person who is one of these figures that we call out as statistics today. They are not statistics, they are people with faces that you can place. They come from homes and from families that you know. So I want us to take this matter more seriously. I'm passionate about it because I know that there's no other thing that we can do except to try as much as possible to convince our people, to coerce our people, to enforce the need for compliance with the non-pharmaceutical measures. Because that's the only remedy, that's the only weapon we have at hand now to be able to confront the ravaging effect of COVID-19. You can see our figures. The burden, 5 states account for 60% cumulative figures. So there are some states that are becoming overburdened. Yes, we might argue that in the last 1 week, the figures of confirmed cases seem to be plateauing. But when you look at that, look at also the number of tests that have been conducted, because there's a direct relationship. With the 62 testing facilities or laboratories that we have spread over 31 or 32 states plus the FCT in Nigeria today, we have a testing capacity of over 10,000, I believe. We have a testing capacity of over 10,000. But in the last 1 week, especially the week of the Salah festivities, you will see that our testing capacity ranged between 2,000, 2,500. Those were the only tests we were having. I believe that if we ramp up the tests, if the subnationals deploy resources, deploy manpower, collect samples, search, detect, test, and take into isolation and provide care, we will see much bigger figures. And I did allude to that in my in my opening remarks, that of one test that we have confirmed, the likelihood is that 7 would have escaped. So to give you a very good picture of the figures we are talking about, multiply what we have today by 7 of the rates of infections that have probably spread all over this number of local governments. I believe strongly that these 85 local governments are not absolute. If we go there today and test, we will find that there has been infections in those particular local governments over a period of time. So my appeal to you, those of you that are members of the fourth realm, you hold the ace to pushing out this agenda and aggressively doing it, because that's the only remedy we have also now. Thank you and have a good evening.
Thank you very much, Chairman PTF. That brings us to the end of the national briefing for today. A number of messages have come out. The strongest one is to members of the press. You have the voice, you have the platform, you have the medium to communicate with Nigerians. Please do so strongly, do so aggressively. Let the message go out. Let Nigerians know that we face a very high risk. We must be vigilant. We must be very careful. Let them know that the PTF has constantly raised the flag of risk and that we are communicating to all Nigerians in all possible languages and in all possible, on all possible platforms. Wear a mask because it protects you. It protects your family, your friends, and colleagues. Stay safe always. And remember, 8 months down the line, the world has crossed 20 million cases. Africa has crossed 1 million cases. Nigeria stands at 46,577. Where do you belong? Let us be vigilant. Let us try to stay safe. Join the social media campaign, #MaskNiger. Please carry the message out to Nigerians. No mask, no entry. No mask, no service. I thank you very much. God bless Nigeria. We hope to see you on Thursday. Thank you.